Welcome back, everyone, to another deep dive. Today, well, today's topic is something that I think resonates with a lot of our listeners. We're going to be talking about pregnancy, but we're going to be looking at it from a slightly different angle, a little bit more challenging, perhaps. You can even say pregnancy, expert mode. We're
Hmm.
talking about pregnancies complicated by pre-existing conditions.
Sounds pretty intense.
It can be.
Hmm.
It definitely adds another layer of, well, everything, considerations, risks, you name it.
I can imagine.
But before we get ahead of ourselves, let me tell you about what we're working with today.
Okay.
Our main source is a chapter, and it's from a nursing textbook all about pre-existing conditions and pregnancy. And trust me, it's packed with insights, though it's definitely a dense read.
Mm.
So what we're going to try to do today, our mission, if you will, is to break it all down. We want to help you understand just what makes these pregnancies so unique, the kind of challenges both mom and baby might face, and how healthcare teams work to manage these more complex situations.
Sounds good.
Now, I got to tell you, one of the things that really struck me when I was reading this chapter is just how many things, conditions you might not even think are related to pregnancy, suddenly become super important. Skin changes, yeah,
Hmm.
those matter. Substance use, oh, that's a big one. It's all connected.
Interesting.
So to guide us through all of this, we have our expert. Thanks for joining us. Let's start with the basics, like what makes a pregnancy high risk in the first place, and then how do pre-existing conditions change the game?
Right. Okay. Well, so every pregnancy has its own, unique things to think about. But when we say a pregnancy is high risk, what we mean is that there's a greater chance of complications, either for the mother or the baby, or both sometimes.
So higher chances of things not going exactly as planned.
Yeah, basically. And then when you add a pre-existing condition into the mix, it's like it really does complicate things. You need a more, specialized approach to care.
So it's like taking something that's already pretty complex and adding like another layer of, I don't know, another layer of difficulty.
Hmm. Yeah, I like that analogy. You're definitely playing on a harder difficulty setting. The stakes are higher.
Right, exactly.
And that's when it becomes really clear just how important a multidisciplinary approach is. It's not just, the OBGYN taking care of everything. It's a whole team of specialists working together. We're talking nurses, dietitians, maybe you need a cardiologist or an endocrinologist, depending on the situation.
So it takes a village, as they say.
That's a good way to put it.
Okay, so we've got this idea of high risk and how pre-existing conditions add to that. Let's get specific now. Let's talk about diabetes mellitus. It's actually pretty common and it can really impact a pregnancy. What makes it so tricky?
Well, diabetes during pregnancy is kind of a delicate balancing act. You have to be
Right.
very careful, make constant adjustments. And we really have two main scenarios here. You have women who already have diabetes before they get pregnant. That could be type 1 or type 2. And then you have women who develop gestational diabetes during their pregnancy.
Two different scenarios, but both requiring close attention.
Exactly. And speaking of attention, the chapter really stresses how important preconception counseling is for those women who already have diabetes.
Yeah, I noticed that too. It seemed like a big deal. Why is that so important?
Because it's all about getting ahead of things, managing potential risks before they even become a problem. So for example, if your diabetes isn't well controlled, there's a higher risk of macrosomia. That's where the baby grows larger than average. You can also have polyhydramnios, too much amniotic fluid.
Oh, so it's not just about having like a bigger baby, it's about the potential issues that can come with that, right? Like
Yeah.
during labor and delivery, a larger baby's got to be more difficult to deliver.
Exactly. You've got it. Think of the uterus like a container. It's designed perfectly for the baby. But if the baby gets too big or there's too much fluid, it puts pressure on everything. So preconception counseling, that helps us, work with the mom to be to try and avoid these issues. Aim for a smoother pregnancy and delivery.
Makes sense. Yeah. Now, one thing that surprised me in the chapter was this link between uncontrolled gestational diabetes and the child's risk for obesity later in life. Like, I wouldn't have connected those two.
It is interesting, isn't it? And it shows just how important managing diabetes during pregnancy really is. It's not just about those 9 months. It can actually have long-term effects on the child's health.
Wow, that's something to think about.
Yeah.
So we've got the macrosomia, we've got the fluid levels, but it doesn't stop there, right?
Yeah.
The chapter also talks about a higher risk of stillbirth and congenital malformations. That's pretty scary.
Yes, unfortunately, that's true. And when we talk about malformations, we're talking potential problems with the baby's cardiovascular system, their
Yeah.
central nervous system, even their skeletal development. So it's a serious thing, and it really emphasizes why this Careful, meticulous care is so important.
Right, so we're talking about way more than just, like, watching your sugar intake here. What does this meticulous care actually look like in practice?
Well, it's pretty comprehensive. It starts with, being very careful about diet. For some women, it might involve insulin therapy. Then there's regular blood glucose monitoring, got to keep those levels in check. And we also do regular fetal surveillance to make sure the baby's growing at a healthy rate.
So there's a lot of monitoring, a lot of teamwork between the mom and her healthcare providers.
It is, definitely. Now, you mentioned diabetes adding complexity, but and this is something we can't forget. Pregnancy itself, just being
Yeah.
pregnant, puts stress on the body. What about the cardiovascular system? How does that handle things?
Oh, that's a good point. Like, even without any pre-existing conditions, pregnancy is putting a lot of demands on the body.
Right. Pregnancy is amazing. It's this incredible feat, but the cardiovascular system, the heart and blood vessels, they go through a lot of changes. Blood volume increases like crazy, and there are like shifts in vascular resistance too.
So even a healthy heart is working harder than usual during pregnancy.
Absolutely. So now think about a woman who already has a pre-existing heart condition. Those normal changes, they become a much bigger deal.
It's like asking someone to run a marathon, but they're already carrying extra weight, you know what I mean?
I like that. That's a great analogy. And it's not just about getting through the 9 months. It's about how these changes might impact labor and delivery. And even after the baby's born, that postpartum period, the heart's under a lot of stress during those times. And the healthcare team has to be ready for anything.
It sounds like a constant state of vigilance. The chapter also goes into anemia, actually a few different kinds, right? Iron deficiency anemia, folic acid deficiency, and then sickle cell anemia. That was news to me. I didn't realize there were so many types.
Right. There are different types, and they all matter during pregnancy. Each one comes with its own set of concerns. Iron deficiency anemia, that's the most common, but all three of them can impact the baby's development and their overall health. So it's something we monitor very closely and, try to address proactively.
Makes sense. Now, this is where things take a turn, maybe a little unexpected. The chapter gets into how pregnancy affects the skin. Honestly, I hadn't really thought about that connection before.
Oh yeah, those pregnancy hormones, they can really do a number on your skin.
Hmm.
You get things like melasma, which is like those dark patches some women get, or vascular spiders, those tiny little red lines. You can even get reddening of the palms. It's called palmar erythema.
And of course, let's not forget about stretch marks. I think those are a big concern for a lot of moms to be.
They're very common, definitely. And while they usually fade with time, they're definitely like a visible reminder of how pregnancy changes your body.
Right, right. Now, one thing that caught my eye was a condition called PUPPP. What is that exactly? Not familiar with that one.
No, yeah. PUPPP. It stands for Pruritic Urticarial Papules and Plaques of Pregnancy.
Wow, that's a mouthful.
I know, right? Basically, it's a rash, a really itchy rash that can develop during pregnancy, usually in the third trimester. It can be pretty uncomfortable, but the good news is it usually goes away after the baby's born.
Okay, good to know. So we've covered diabetes, heart conditions, anemia, even skin changes. I think it's time to address a more sensitive and
Ah.
maybe more challenging topic, substance abuse during pregnancy.
Yeah, this is definitely a topic that needs a delicate and compassionate approach. And what we often see, as the chapter points out, is this thing called dual diagnosis. That means you have substance abuse happening alongside another psychiatric disorder, which can make treatment much more complex.
It sounds like there are a lot of layers to unpack there.
There are, and one of the things the chapter pointed out that was really startling, to me anyway, was that less than 10% of pregnant women struggling with substance abuse actually get treatment.
Wow, that's a really low number. Makes you think about all the barriers these women must be facing.
It does. It's really concerning. You've got the fear of legal repercussions, getting in trouble with the law. There's often a lack of specialized programs that are actually designed for pregnant women. And then there's the stigma, that feeling of shame, which can be a huge barrier to getting help.
It's like a perfect storm of challenges. And I noticed the chapter specifically mentioned Texas, how they have emergency Medicaid and CHIP available in these situations.
Right.
I wonder what kind of resources other states have.
Right. Access to healthcare, it really shouldn't depend on where you live. But even when there is access, there are still challenges. We need to be doing drug testing to figure out the best course of action, and screening for substance abuse should be a routine part of prenatal care.
Screening and testing to get a clear picture.
Exactly.
Now, the chapter also talked about intervention, and specifically about methadone maintenance programs. What exactly are those and why? Why are they considered helpful in these situations?
Well, methadone maintenance programs are specifically designed to help people manage opioid addiction, but in a safe way. They involve giving a controlled dose of methadone, which is a synthetic opioid, and it helps reduce those withdrawal symptoms and cravings. And for pregnant women, this can be a game changer. It helps stabilize their health, which in turn reduces the risk of complications for both the mom and the baby.
So it's about kind of meeting them where they are and helping them manage their addiction in a way that's safe for both of them. But even with these interventions, there's still the issue of breastfeeding, right? The chapter mentioned that it's not recommended for mothers who are using certain substances.
You're right. It can be a really sensitive and difficult topic. Certain substances like amphetamines, alcohol, cocaine, heroin, even marijuana, they can pass through breast milk and harm the baby. So, in those cases, breastfeeding is off the table, and we talk to the mom about other ways to feed her baby.
It's a lot to consider, a lot of factors at play.
It really is, and it shows how complex this issue of substance abuse during pregnancy is.
It's not just black and white.
Not at all. We need to address both the physical and the psychological aspects of addiction. And we have to remember, we're essentially taking care of two patients here, the mother and the developing baby. Their needs are completely intertwined.
So it's almost like you're playing this delicate balancing act, trying to ensure the well-being of both while also dealing with a very sensitive, often stigmatized issue.
You said it perfectly. It's a balancing act, and it requires compassion, expertise, and a really deep understanding of all the challenges these women are facing.
It really makes you appreciate,
Uh-huh.
how much is going on during these pregnancies. You've got all the normal changes happening, but then you layer on this whole other element of managing a pre-existing condition. It's a lot.
It is, and it really highlights how important those early checkups are. The monitoring, making sure things are on track. It's like trying to stay one step ahead, anticipating any potential problems.
That makes sense. We've been talking a lot about the medical side of things,
Mm.
but I'm curious about the emotional and psychological impact on the women going through this. It's got to be tough, right?
Oh, absolutely. It's a lot to process, both physically and emotionally. Imagine the stress of knowing your pregnancy is considered high risk. That alone can be really overwhelming.
Right. And then there's this pressure, like societal pressure to have this perfect pregnancy, which probably makes it even harder to like open up about any struggles.
It's true. I think, we need to create an environment where women feel comfortable sharing their concerns. It's okay to not feel okay, especially when you're facing these added challenges.
Absolutely. And it's not just the mother's emotional health, right?
Yeah.
I mean, the chapter talks about how all of this can potentially impact the baby too.
Right. That's a really important point. Stress and anxiety during pregnancy, they can affect the baby's development. So it's another reason why it's so important to have that comprehensive care that takes into account both the mother's physical and emotional needs.
Because they're connected, right? You can't really separate the two.
Exactly. You've got it. Mind and body, they're all connected for both the mom and the baby. So we need to think about that.
Okay, so let's talk about solutions.
Yeah.
What can we do to better support women who are, navigating these complex pregnancies?
Well, one thing is making sure they have access to the care they need. Specialized care and support services. Those resources need to be available and easy to access no matter where you live or, your financial situation.
Right. Everyone deserves access to quality care.
Oh.
The chapter also mentions support groups, how they can be really helpful. Why is that?
Well, support groups, they offer this safe space for women to connect with others who understand what they're going through. They can share experiences, offer support, and just realize that they're not alone in this.
That feeling of community, that can be so powerful.
It really can. Just knowing that someone else gets it, has been there, it can be incredibly empowering.
I bet. Now, beyond support groups, what are some things healthcare providers can do? Like, how can they enhance the care they're giving to these women?
Communication, that's huge. Taking the time to really listen to the mother's concerns, answer her questions honestly and thoroughly, and explain things in a way she understands.
It's about empowering her to be involved in her own care.
Exactly. And it's about building that trust, that partnership between the healthcare provider and the patient. Because that open communication, it's essential. It's really the foundation for navigating these complex situations.
Right. It's not just about treating the condition. It's about caring for the whole person.
That's a beautiful way to put it.
So we've talked about the medical side, the emotional side. But there's another layer here, right? Like The societal factors that can impact these pregnancies.
Oh, you're absolutely right. We can't ignore those. Access to quality healthcare, that's a big one. But it's also about things like affordable housing, access to nutritious food, even having a supportive community. All of these things play a role in maternal and infant health.
It's recognizing that health disparities exist, that certain groups face more challenges getting the care they need.
Yes, exactly. We need to address those systemic issues if we really want to create a system that works for everyone. A system that supports all mothers and babies, no matter their background.
It's about equity, fairness for everyone.
That's it, exactly. Every mother, every baby deserves the best possible chance at a healthy life.
And sometimes that means looking beyond the individual and thinking about those broader social and economic factors.
It does. We need to support policies and programs that promote maternal and child health. Things like access to quality prenatal care, affordable childcare, and paid family leave. Those things make a difference.
It's about building a society that values families.
Yes, I like that. And it reminds us that we all have a role to play. We can all work towards creating a more supportive environment for pregnant women and families.
So as we're wrapping up this part of the discussion, what's the main takeaway you hope our listeners are getting from this?
I think the most important message is that high-risk pregnancies, while they are challenging, they're not hopeless. With the right care, support, and resources, both moms and babies can thrive. And it's up to all of us collectively to make sure every family has that opportunity.
I love that. A message of hope and collective responsibility. I think it's time to shift gears a bit and look at this from a slightly different angle. We've talked about so much, the medical stuff, the emotional side of things, even how society plays a role. But I want to bring it back down to earth for a minute. Like, let's say you have a friend or a family member who's going through one of these challenging pregnancies. What can you actually do to help? I feel like everyone says, let me know if you need anything, but is that really helpful?
It's well-intentioned, but yeah, it kind of puts the burden on the person who's already struggling. They have to figure out what they need and then reach out. It's better to be more proactive, I think.
So instead of that vague offer, what are some like concrete things someone could do?
Think practical help. Offer to cook some meals, maybe run some errands for them, help with childcare if there are other kids in the picture. Even just being a listening ear, letting them vent or cry if they need to. Those things can make a huge difference.
It's about actions, not just words.
Exactly. And remember, it doesn't have to be some grand gesture. Little things done consistently, those can have a huge impact.
This whole conversation has really shown me how important empathy is. Just trying to understand what someone else is going through.
It is, and it's about recognizing that every pregnancy is different. Every woman's experience is valid. There's no one right way to support someone, just like there's no one right way to manage a high-risk pregnancy. It's all very individualized.
Well, we've covered a lot of ground today, haven't we? From the medical details to the emotional roller coaster and all the societal stuff in between. But I think at the end of the day, it all comes back to the human element. These mothers are incredibly strong. The healthcare teams are dedicated and working hard. Then you have the support from loved ones. It all matters.
It does. It's a reminder that even when things are tough, there's still hope, there's strength, and there are people who care.
So well said. And on that note, I want to thank everyone for joining us on this deep dive into the world of high-risk pregnancies. We hope you learned something, that you feel a little more empathy, and maybe, just maybe, you feel inspired to be a better ally to those who are going through these challenges.
It was great being here. Thanks for having me.